So now we're going to talk about the long-term complications of diabetes. They're caused primarily by glycosylation. Remember that I said glucose is sticky, it likes to bind to stuff. That's how we can use A1C to measure progress or control over a couple of month time period. But it also binds to the membranes and blood vessels. So that's going to affect the small vessels first because they've got less room. It just binds to the membrane, gunks them up, causes inflammation, causes cholesterol plaques to form. And so the small vessels get occluded pretty quickly by that. So the higher blood glucose levels remain, the more microvascular damage that we see. Microvascular damage, we look at retinopathy, so they have may have vision changes, nephropathy, so we're monitoring GFR and creatinine because they can develop renal damage, and neuropathy. Okay, so it contributes to neuropathy. As the larger vessels become affected later on, that increases the risk for cardiovascular disease, hypertension, MI, stroke. And then it also affects the ability to heal wounds. Neuropathy is caused by poor perfusion due to microvascular disease, but also the glycosylation of the nerves themselves directly. Neuropathy is irreversible. It can be difficult to control, and it tends to be progressive. So someone will say that usually it starts with the feet. Their feet will be both numb and also have constant burning pain. So they can't feel stepping on something, big risk for wounds, but they have constant burning pain in those same feet. So those are the long-term complications, and they are preventable by managing blood glucose. So we want to teach patients to prevent and delay those as long as possible by maintaining a good blood glucose control.